In this lecture, we will discuss the role of thirst in controlling extracellular osmolarity and sodium concentration. In the last few lectures, we have been discussing the role of antidiuretic hormone in controlling plasma osmolarity or extracellular osmolarity as well as sodium concentration. We discussed in much detail that whenever there is a decrease in blood pressure, or whenever there is a decrease in blood volume, or whenever there is increase in plasma osmolarity, there is release of antidiuretic hormone from the posterior pituitary gland. And this antidiuretic hormone, antidiuretic hormone, sorry, ADH, it then stop the diuresis, and it keeps on reabsorbing a lot of water from the nephrons, and it tries to maintain the fluid in the body. Now, antidiuretic hormone is important, but it is not enough to keep the osmolarity and sodium concentration constant or normal. Suppose, for example, the human body starts losing fluid, and the blood pressure and the blood volume has started decreasing because the fluid has started going out from multiple points. At a point when the blood pressure has decreased and the plasma volume has decreased and the sodium concentration has increased, this will lead to release of antidiuretic hormone. This will lead to release of antidiuretic hormone from the posterior pituitary gland, and the signal will comes from the hypothalamus. And the mechanism through which this signal comes, we have discussed that thing in detail. Now, this antidiuretic hormone, it will stop diuresis, or it will reabsorb all the fluid from the nephrons in the kidneys, and it will not allow any kind of fluid to go out from the kidney. It will try it level best. Now, reabsorption will occur and the fluid in the body will be maintained, but what happens is that a lot of fluid loss occurs from the skin. Also, a lot of fluid loss occur while breathing from the lungs. Similarly, fluid loss may occur from the GI, from the gastrointestinal tract, or fluid loss may occur through vomiting. Now, antidiuretic hormone may stop the loss of fluid through the kidneys, but it cannot stop the loss of fluid through the vomiting, through skin, through GI tract, through breathing. So fluid loss is occurring slowly and gradually, but it is occurring. So what is important? The important thing is that there is then role of thirst. The thirst mechanism is activated. Now, the thirst mechanism, it is activated with the help of thirst center. And what is thirst center? Thirst center is basically present in the same areas in which the osmoreceptors are present, the osmoreceptor ADH system. So the thirst center basically includes neurons in the anteroventral wall of the third ventricle. Anteroventral wall of the third in the anteroventral wall of third ventricle. The area where we discussed is the AV3V area, which we have discussed in detail. So in the anteroventral wall of the third ventricle and anterolaterally in the preoptic nucleus. Here is the preoptic nucleus. So in these two areas there are neurons which function is thirst center, and they make the thirst center, they get activated, and the neurons of these areas, they act like osmoreceptor. When they get activated, they help in compelling the human or the person to drink a lot of water. So the person starts drinking because the mechanism has been activated, and it leads to drinking of a lot of water, and the fluid that has been lost is replenished. So the fluid lost can be replenished up to some extent with the help of thirst. So even this mechanism may not be sufficient, and there may be need of IV fluid in some circumstances, or in a lot of circumstances, which we do in a lot of emergencies. But these things are important, and we now know that to control the extracellular osmolarity or the plasma osmolarity and the plasma sodium concentration, the antidiuretic hormone is important, but its importance is limited to kidneys or nephrons only. To stop or to replenish the fluid loss that is occurring through the respiratory system, through the GI system, or through the skin, we need to take in the fluid which has been lost, and for this purpose we need the thirst mechanism to be activated, and the thirst mechanism is activated with the help of thirst centers. And the thirst centers basically is found by neurons present in the anteroventral wall of third ventricle here, and anterolaterally in the preoptic nucleus, and these neurons act as osmoreceptors. So they detect the plasma concentration, they detect the plasma concentration of sodium, and they detect the osmolarity, and in this way they activate the thirst mechanism. Now, one thing is very important. Whenever a lot of concentrated fluid is infused in the body, these neurons are activated. So it confirms that these neurons basically make the thirst center. And also, increase in the sodium concentration of CSF, it also promotes drinking. So it means that whenever the concentration of sodium in the CSF increases, this area, the anterior ventral wall of the third ventricle, which is in touch with the CSF, it gets activated, and it also lead to it also promotes drinking, which is due to the thirst center, which is due to the thirst mechanism. So that's all about the role of thirst in controlling the extracellular osmolarity, plasma osmolarity, or sodium concentration, and their role in keeping homeostasis, in their role in keeping the circumstances normal, the normal physiology of the body. Thanks a lot for watching the video.